I'm self-employed with a small business. I've got a handful of employees, and part of my incentive package for them with their salary is that I cover their health insurance. I came across Blue Cross Blue Shield 15 years ago, and I've been with them ever since. Blue Cross has made a difference in my life and my employees' life by giving us the security of knowing that Blue Cross Blue Shield will stand behind us, whether something planned or something urgent. We have Blue Cross Blue Shield to back us up. That gives us peace of mind.
Doctors New Orleans is underwritten by Blue Cross and Blue Shield of Louisiana, Winn-Dixie, and New Orleans Living Magazine, highlighting the best of our city.
Welcome to Doctors New Orleans, where you get to see firsthand how some of our local leading healthcare experts tackle health issues that are important to you. I'm your host, Maria Muro, and each week our goal is to help you take charge of your health. On tonight's show, we discuss a procedure for patients suffering from a deviated septum. We cover back pain treatment options, a smoking cessation program, and then we meet a patient who shares his drug addiction story. And in the second half of our show, we will discuss drug and alcohol addiction treatment. Very important show. So now let's get started.
My name's Reggie. Just recently, my wife and I took in her sister's children. Now, we already had 4, so I went from becoming a family man to a man with a bigger family. Now, you can't eat love, so I don't know how I'm gonna feed them tonight. How was that, Reg?
I think I look more like Denzel.
That's cold, man.
Play a role in ending hunger. Visit feedingamerica.org/hunger and find your local food bank.
Septoplasty is a corrective surgical procedure done to straighten the nasal septum, the partition between the 2 nasal cavities. Ideally, the septum should run down the center of the nose. When it deviates into one of the cavities, it narrows that cavity and impedes airflow. Dr. Akash Anand, an ENT at GNO Snoring Sinus, offers patients this procedure. Take a look.
Hey Vin, nice to see you. Thanks so much for coming today. Today, pretty much, we're gonna take Vin to the operating room. He represents a unique subset of patient. He's a patient who actually is very young and has lost a tremendous amount of weight, 35 pounds from what I understand too. Even after losing that amount of weight, he's still having problems with sleep. So as a result, based on his anatomic exam in the office, it's all associated with his actual airway obstruction. His nasal obstruction in the nose from a deviated septum, his very large palate as well, and elongated uvula. No matter how much he weighs at this point, those structures will still persist, whether he's 1,000 pounds or 10 pounds. As a result of that, we're gonna focus on performing some airway surgery and enhancing his actual airway. You ready for today?
I'm ready.
All right, we'll get you all set. Nice to see you.
My first experience with Dr. Anand, I kind of stumbled upon him. I've been looking for a doctor, and just somehow I landed to his doorstep. And he brought me in without, just wanted to overlook at me, and he gave me an evaluation. And I was like, oh, it's pretty good. I liked him. I liked his personality. I liked how he treated his patients, and just me personally. Very welcoming. So, and then I was still looking after that, but somehow just brought me back to the Dr. Anand.
Today we're going to take Vin to the operating room, and we're really going to focus on his nasal airway. Vin represents a really unique subset of patients. He's lost 35 pounds on his own. He's done all the heavy lifting, but unfortunately his nasal obstruction will still persist. He's the kind of patient who doesn't sleep well at night. He has some sleep apnea, but in addition, he also has some daytime nasal obstruction, which is limiting his oxygen flow, of course, through his lungs. And as a result of that, and actually understanding the anatomic airway obstruction that he possesses, we're gonna fix him and give him a whole lot of relief. So again, for Vin today, the main problem lies in the nose, and that's the reason why he has persistent problems breathing despite such a tremendous weight loss.
For about 15, 20 years growing up, I noticed that, people would tell me I'll stop breathing at night. And, for people from my culture, we really don't see it. And that's not something that it triggers or something that stands out, because it's not like a blood cut or anything like that. It won't So finally, just 10 years later, my sister got her procedure done and realized that it changed her life. Sleeping, coming from snoring, be able to breathe at night, my heart's not stopping. I don't wake up like almost having a heart attack, pretty much. I mean, it's just, there's so many times where I felt like I was about to get a heart attack. So then that's pretty much pushed me to go see Dr. Anand again. I did the whole sleep study, and it was very, very helpful. So, and then now I'm going through the procedure to get on board.
Okay, so at this point we're going to work on Vin's nasal airway. The nasal airway is the most important part of his surgery because the majority of his obstruction is in the nose. Needle, light over that be. What we've noticed is that despite all the weight loss that he's had, of course, the nasal obstruction still persists. In this case, the nasal surgery will take us about 30 minutes to perform. When he wakes up, it's very simple. There'll be no packing in the nose, and there's no splints in the nasal airway either. As a result of that, he'll breathe well immediately upon waking up. The recovery for this portion of the procedure is very, very straightforward. It's about 2 to 3 days of some mild nasal congestion. In his case, he can resume work tomorrow, so there shouldn't be any effect to his daily personal activities. The nasal airway is corrected by slightly moving over the deviated portion of his cartilage and bony septum and then restitching it in place. We don't break any significant bones. There's no bruising on his face and no black and blue as well. At the end of the day, he's going to wake up with much more room to breathe and much more airflow, and that'll improve his overall situation. Okay. To get him nice and numb, we use the lidocaine with epinephrine. We inject that at multiple points in his nasal airway. That allows us to decrease bleeding and also provide him with a level of anesthesia. After we wait a little bit of time, at that point we then make an incision in the left side of the nose, and I can see here already he's got a significant deviation off to that side. So what we'll do at that point is we'll then skeletonize and elevate the mucosa, which is the pink lining inside our nasal passage, and we'll elevate that off of his actual deviation, and then we'll remove it. Okay, after. This is some Afrin on a little piece of cotton. This allows us to provide some decongestion. As everybody knows, Afrin is extremely effective at allowing us to breathe very well through our nose. We never recommend it long term, but in the operating room we use it consistently to allow us to provide a level of decongestion for these patients. What I'm doing right now is I'm out-fracturing his inferior turbinate. The inferior turbinate is the structure that causes all of us to have significant congestion. By using this device, we can actually push that over and provide a significant improvement in the patient's level of breathing through the nose. Okay, Goldman, I'll take this. The next thing we're going to do is use this device. Do we have the foot pedal, Anita? Okay. This device allows us to develop a little radio frequency energy. What it will do is allow us to shrink the patient's turbinate in the nose. And in the process, we're going to shrink his inferior turbinate. So we just started off by actually out-fracturing it, and now we're going to actually shrink that structure. This provides a very controlled treatment, and we don't damage any adjacent tissue. And now what we're going to do is what we did in the beginning. We're going to fracture over that structure. So this is a mild displacement of the inferior turbinate. And as we take a look right now in his nose, he's got about a 60% improvement in his airway from that portion of the procedure. The next portion of the procedure is the septoplasty. I'll take the scalpel. That up, elevate these mucosal flaps, which again are the pink lining in the nose, and that'll allow us to address them in a very targeted fashion. There's no point in being aggressive with patients like this. What we do is we find the point of obstruction and then we correct it specifically. That way the patients have an excellent outcome and they preserve the maximum amount of function as well. At the end of the procedure, when Mr. Wen wakes up, he'll have, some mild congestion in his nose. There'll be no packing, no splints. He'll head to recovery and he'll head home in about 15 to 30 minutes. At that point, he'll come back the following day. We'll take a look at his nasal passages. There's no splints, there's no packing in his nose. There's nothing for us to remove. So at the end of it, he's got a very good outcome with very minimal discomfort. After this procedure is done, after about 2 to 3 weeks, he's going to notice an overall improvement in breathing. Actually, he'll appreciate that within the next few days through his nose. As the oral portion of his procedure, his throat heals up. Over the next 2 to 3 weeks, he'll have a significant improvement in breathing, improvement in daytime energy, and improvement in sleep, which is the most important part of the process.
Our promise to you is to be your hospital for life. Being the CEO at Slidell Memorial Hospital gives me the chance to be passionate about a mission that is focused on the community and not just healthcare delivery. We're providing a culture and an environment where only the best doctors, nurses, and technicians want to work. With the community's investment, they deserve the latest in technology so that they can receive these services right here at home.
Slidell Memorial Hospital, your hospital for life.
In this segment, we meet Dr. Joel Berry, an interventional pain management specialist at Paradigm Health System. He discusses back pain and treatment options.
My name is Joel Berry. I'm an interventional pain management physician. I came into the practice because I like being near my patients. I like having a relationship with my patients. I'm a trained anesthesiologist and I enjoy anesthesia, but it was just put them to sleep, wake them up, and you're done. I like to see patients come in, and it's gratifying to be able to help relieve them of pain. Pain is one of the most common complaints when the patient enters to see a physician. So I like to be that guy that can help that patient out and let them help to get their life back. The patient comes to see me on the first visit, and we have a very in-depth discussion. Obviously, what's your most common pain complaint? What's bothering you the most? And for the number one thing, obviously, most commonly is low back pain. And so then why, when, where, how, and have a dialogue with the patient, understand how it does affect their life. Also, that's part of the history. You have to do an adequate physical examination. So I lay my hands on the patient and examine what is going on. So I take the history, the physical, and I combine it with sometimes, most oftentimes, imaging. And so I take these three things and combine it all together to make a plan of care for the patient. When a patient comes to me with back pain, the most common complaint is my pain starts in my back and it runs down to my right knee and into my right big toe. And so that to me tells me exactly what's going on. It's usually, most commonly, it's a disc protrusion, a herniation, compressing the nerve root in their low back, and it causes this sharp shooting, burning, searing pain. And this can dramatically affect the patient's life. From one moment they're out running and enjoying playing with their kids, their family members, or even simple things, going to functions, family events or concerts, and this pain prohibits them to doing that. And so I'll see after getting everything together with the physical history and imaging, then we'll say, I have a plan, here's my plan for you. Make sure they're on good anti-inflammatory medications. Make sure if they've not had physical therapy, we can get them enrolled into a physical therapy program. But oftentimes the therapy, it hurts to do. And so here's what I can do to help you. I can give you an injection into your back using very, very good C-arm X-ray imaging technology, and we do this live and put the steroid right close to where the herniation is, and we can make that pain, help that pain go away, so you can get your life back. Part of the treatment plan in patient care at the interventional pain management physician, you have the patient come in for the initial consultation. After the consultation, then we'll either continue conservative therapy, or if you require it, we can do a pain management interventional procedure. Once we do that procedure, it may require one, it may require two, but as minimal as possible. We want to get you better as fast as possible. Sometimes the first procedure may be more diagnostic, and then the next procedure may be geared to more of the therapeutic variety. Interventional pain management is a very important specialty to be multimodality, meaning you see the interventional pain physician, but I think that it's important to have other groups involved, namely an orthopedic surgeon, a neurologist, and this helps to provide a team to surround the patient with so we can provide them the best care. The neurologists help to provide other diagnostic clues to help us get your plan of care to the level that we can get you the best relief. Unfortunately, if I'm not able to help you with your pain, and this means it's a mechanical problem, and it requires surgery, then we have great relationships with the orthopedic surgeon that we work with, and he can get you the best relief to fix the problem. If you've been in pain for a couple of weeks and your quality of life has been adjusted, meaning you can't enjoy the things you like to do normally, simple things, the dishes, you can't clean the house, you can't enjoy time with your family, you can't exercise, or you can't partake in those activities of daily life you enjoy, then it's time to come see me. We have a very high patient satisfaction in the field of pain management. I mean, I'm able to give your life back. I think there's nothing more gratifying.
Hi, I'm Sean Payton, and I'm here at my neighborhood, Winn-Dixie, where they stock all the fresh and healthy foods we need to live well. The Saints in Winn-Dixie are committed to help the people of Louisiana get fit and stay healthy. Exercising and eating right is easy when you have your whole community to support you, because together we are better. Winn-Dixie and the Saints invite you to join our team. It's easy, it's free, and it's fun. Sign up at livewelllouisiana.com today.
Hi, I'm Julie Fortenberry, registered dietitian with Live Well Louisiana, and today we're in our local Winn-Dixie talking about healthy meal planning. Healthy meal planning does start in the store. If you make proper choices here, you're less tempted at home. It's important to plan ahead, involve your family, and see which foods they'd like to eat for the week. Be sure to stock your cart full of healthy options from the produce section, lean meats, and healthy fats. For a quick healthy guide, look for the Live Well Louisiana logo at your local Winn-Dixie stores for the healthiest options available. The grocery store is a great classroom to teach kids. Take advantage of this time. Teach them how to properly pick produce, how to fill their grocery cart full of healthy options, and how to make a shopping list and plan ahead. For Live Well Louisiana, I'm Julie Fortenberry.
Smoking is addictive, and it kills thousands of people each year. For those of you looking to quit, you are not alone. You have options. Here is one story of courage. Watch this.
I've been smoking since I was 15. And right now, I'm 61 years old. I've been singing in the choir at Dularge Community Baptist Church for 18 years. And my pastor's wife, Miss Mary Parker, stayed on my case about stop smoking. It wasn't good. And I just used to say, oh, all right. I just brushed it off. But I wish I'd have listened a little bit sooner.
Just take a few minutes to
Because really my health might be a little bit better than what it is now.
Oh, hey, Miss Lillian, how you doing? Good to see you today. Good to see you. How are things?
Dr. Stagg been on my case since 1992 about smoking. And every time I come for my appointment, Miss Lillian, are you still smoking? Yes. What have I told you?
I work every single day with every single patient trying to get them off of cigarettes. Cigarettes are the bane of my existence. The reason that smoking is so personal to me is that I'm 57 years old now. Well, my mom died when she was 53, and she smoked all her life, and she died of lung cancer. It almost brings me to tears thinking about all the stuff she missed, and all the life she missed, and how much we miss her, and all because of cigarette smoking.
Are you breathing better? Yes. I figured you would.
Smoking causes 80% to 90% of lung cancer, 80 to 90% of chronic lung disease like emphysema and chronic bronchitis. About 50% of cardiovascular disease is directly related to cigarette smoking. So, is it hard to tell people to quit smoking? No. It's very easy to tell people, you got to quit smoking. But it's so hard to quit smoking.
My mother stayed on my time about smoking. I quit for 2 years and I started back. But after she passed, I started smoking again, and I've been smoking ever since. Until that Sunday I came from church. I never watched Buy Your Time. I said I was gonna look at Buy Your Time that day. Who did I see?
Welcome back to Buy Your Time, and let me introduce the panel. Well, you know Dr. Jody Stagg.
And it was talking about smoking.
Stop to think about it.
And some of the things that he was saying smoking do to you.
Most
people that smoke end up with a cigarette-related illness, and that's either cancer, or it can be osteoporosis, it can be heart disease.
A lot of people are going to watch it, are going to say, all right, no more excuses. Dr. Stagg fussed at me on TV, no more excuses.
I say, oh, he talking about me. So I remembered the number and I called it the next day. I was having pains in my leg, shortness of breath, finger swelling, ankles, skin itching.
Because through the years, you've been having symptoms of, you have a little blockage in the heart, your heart's a little on the thick side. You also have symptoms where your heart beats too fast and palpitations.
The smoking cessation program that we've started has been very attractive to our patients. Many patients say, I cannot do it by themselves, or I cannot afford the medications. Now, our doctors can have a different approach with this patient.
Any Louisiana citizen who began smoking cigarettes prior to September 1st, 1988, can enroll in the trust. The trust provides medical services that are designed to help people stop smoking. That includes a basic office visit with your doctor. You have access to counseling programs, which are highly effective in combination with medication, and we cover all the cost of medications that are recommended for quitting smoking. The program pays 100% of all approved services. There's no out-of-pocket expense. Anyone who's eligible can quit smoking for free.
But I'm glad I called, because since I've been on the patch and the pills, I've been doing fine. I haven't been wanting a cigarette, especially like in the morning when I wake up, I usually smoke 2. And after everything I eat, I smoke. Right now I don't do it, and I feel 100% better. And I haven't smoked since I got my patches and my pills.
How about when you're out walking and stuff now? Do you feel like that you're getting better air and that you're feeling better?
Well, I don't get out of wind anymore. Dr. Stagg act like he's more happier than what I am, like if he was the one quit smoking. But I did it. I should say we did it.
Is it too late to stop smoking? Or is the damage done, am I beyond repair? And the answer is absolutely, unequivocally no. It's never too late. If you quit smoking today, that it's not that long in the future that you will be at the risk of somebody who's never smoked before.
I quit a month and 15 days ago, and I feel great. I feel like I could run a marathon right now. At first, I couldn't even walk a half a block without stopping. And I'm hoping by me quit smoking, I could add 10 more years to my life. I could look at television without smoking. I could eat without smoking. I could get angry without smoking now. And that's the best part. And I'll tell anybody, quit smoking, because the life you save may be your own.
Imagine the world through the eyes of your child, a place full of giants and unreachable places. Now imagine a world if it were designed to fit them, a place where the giants come down to their level, and even the smallest detail is, well, smaller. A place where everything revolves around the kids and their health. Not only did we imagine such a place, we built it with the help of our design team, of course. Children's Hospital New Orleans, caring for every child is our own.
Welcome back. Substance addiction is a growing issue in the United States that impacts millions of people and their families. 23 million Americans aged 12 or older suffer from alcohol and drug addiction. Meet Landy. He's an addict who shares his courageous journey through recovery. Take a look.
I'm Landy. Out with friends and starting recreational drugs was
part of my lifestyle. Then at one point in time when things started bombarding me and stuff, things kind of got out of hand. And then it progressed to me spending almost $1,500 a weekend on coke and drinking and all these different types of things. And then I realized I was becoming a hot mess. And waking up one morning and looking at the ceiling, I had to say that it's time for it to end, and either you take me or I need to find a place to go. And I can remember walking in the first day of the meeting, Dr. Malik. It really was a different type of way of approach on how to deal with this. I never thought of pharmaceutical medications, in order to help, with getting past something that I knew that I could not do on my own right at first. And, with that and being able to teach me about what was really going on in my head and why I was having such trouble of getting, through this and stuff. And with, Wellbutrin and Deplin, I was able to help control the urges and all. And, along with counseling with Virginia, it was absolutely, wonderful to be able to learn how to cope with things in life and how to manage things in your life. It's okay to say no to family. It's okay to say no to friends. It's, it's okay to make a decision, when someone is in your life and that season has ran its course. It's okay to let it go. It's really a great approach of how to live life and live life healthy, along with managing it with the appropriate therapy and counseling. And, I also used a lot of things in my own life, yoga, meditations and Pilates and stuff with Center Studio in where I live. And I would not be here today, and living my life more healthy and financially in a better shape and being able to enjoy my life. I can honestly say at this point in time in my life, I love myself. I can look in the mirror and say, I really like the guy I'm looking at and enjoying my life and finding out who my solid friends are and people who are going to be there regardless if I follow my face, if my head is held up high, they're going to share the joys with me in life. And I just can't say enough about Dr. Malik in itself, because there's so many things that he has taught me, that to have a better life and to there is a life after addiction, And even though addiction will most probably be a part of my life at all times, I don't see myself wanting to go back to it and living that chaos and that turmoil. You just don't need it. Give yourself a chance. Give Dr. Malik a chance. I think that if you would allow yourself to get past what someone thinks or what is somebody going to think when they find out I am involved in drugs or I am involved in alcohol, it's not the end of the world. And I think if you give Dr. Malik a chance, I think you could see a lot better way of life.
All right, right after this break, we're going to have an expert in the studio who will be discussing alcohol and drug addiction and treatment options. You can call the number to ask a question. It is 866-3200. We'll be right back.
Doctors New Orleans is underwritten by Blue Cross and Blue Shield of Louisiana, Winn-Dixie, and New Orleans Living magazine, highlighting the best of our city.
How far would you go to protect your child's health? If you're like most parents, that's a distance that can't be measured simply in miles. It's doing whatever it takes, no matter where that takes you. We know how far you'd go. We've been there. In fact, we go there every day so that you don't have to. A fully dedicated pediatric ER and the region's first and only on-site helicopter dedicated to kids, wherever they are. Children's Hospital New Orleans, caring for every child as our own.
Good evening, I'm Maria Muro, and welcome back to Doctors New Orleans. Tonight our topic is addiction. Addiction is one of the most common and devastating diseases in the United States that impacts millions of people and their families. So if you or someone you know is struggling with addiction, we're here tonight to answer your questions, so feel free to call. All right, my guest is Virginia Wilson. She's an addiction counselor at Gulf South Addiction and Wellness, a local treatment center that provides treatment for various forms of addiction. Then I'd like to introduce you to Cecilia. She is a recovering addict who's here to share her story, and we're excited to have both of you on the show. Thank you so much for being here. Thank you so much, Cecilia. My pleasure. You know, first of all, when it comes to, addiction, first of all, it's the first time we've had, we're covering this topic on the show, and I, had the privilege of meeting your team and really saw the amazing work that you're doing. And it really opened up my eyes, because addiction is something that is there, but people don't want to talk about, right, Virginia?
Absolutely.
Right? It's not an easy road,
right?
And that's why I want everyone to know that tonight, feel free to call. Everything's confidential. If you do want to talk to Virginia or Cecilia or me, just call 866-3200 and we'll be happy to help you. Or you can always just call, and if you want somebody to call you back, they can do that as well. They're really good people. All right, so Virginia, a little bit about you. So why did you decide to go into this type of this field of medicine with addiction counseling?
Actually, I think it just kind of evolved as part of my career. I've always been in mental health and counseling, and one of the jobs led to me working with teenage addicts. Probably about, 17, 20 years ago. And for some reason, my path has just continued along that, working with adults. So I've been working inpatient, outpatient, and privately with addicts for probably 20 plus years.
That's an amazing career for sure. And also I think, you call it a career, but after I've learned about, people like you who do such amazing work, I think it's a calling.
It is.
Right?
Yes.
I mean, I know that you have to provide so much compassion,
right.
and these people, who need help are trusting you and your services, and I think that's just a wonderful thing that you offer, everyone. So thank you for that. All right, so tell me a little bit about the concept at Gulf South Addiction and Wellness.
Well, Gulf South uses an integrated approach. We're looking not only at the addiction, but we're looking at the whole person. We're trying to affect and help persons heal mind, body, soul, and spirit. So we have a comprehensive program that addresses all of the domains of their lives.
I think that's great. And tell me about the team, because I know that, in any type of, whether it's orthopedics or any type of, service line, when it comes to medicine, there's always a team approach or others who help. Tell me about how you work with the addict and a team.
Okay, well, I'm excited about the team that I'm working with. We have a wonderful medical director who is Dr. Malik. He's been in the field 25 plus years. He's an associate professor at Tulane.
Okay.
State board psychiatrist. He does forensic psychiatry, works with all populations. And the reason I'm so attracted to Gulf South is his vision. He's a visionary when it comes to addiction. I like the fact that he treats the whole person, and that's attractive to me because, a lot of times we compartmentalize people and just say if you get rid of the addiction, everything else rights itself. But there are a lot of parts of that person that needs attention. And under Dr. Malik's vision, we're providing that. I mean, he's been in the field. He works with so many different populations. He does consults, and he does a lot of assessments. And so he's really skilled, and I'm really grateful to be part of that.
Absolutely. And also the fact that, your program is medically supervised and medically, I guess, developed,
Right.
I think is what differentiates, an addict getting help where you have the medical supervision versus, someone trying to do it perhaps in another way, that doesn't involve a medical doctor, right?
Yeah, they'll come in and they'll see Dr. Malik first. after the admission process to get a full psychiatric medical assessment, which is one of the pieces that's really important that drives our treatment plan for each person.
Okay, I love that. I'm so glad that you just, you brought that up where, when they meet with Dr. Malik, and he's a psychiatrist, a lot of times, and, we'll definitely get more in depth on this, but sometimes someone has an addiction, whether it's to drugs or alcohol, but there could be another underlying issue, right? Like depression or anxiety, is that correct?
Yeah, a mental emotional health component that needs to be addressed as well. And he's one of the best in the fields. I mean, he nails it each and every time, and I think that his genuine care and concern for the patient is what makes him really successful.
And that's why he has you, right?
Yeah, well, hopefully.
Definitely a great team. Okay, so let's get on to the topic of addiction. It's a big word.
It is.
It's a big word. It's a word we don't like, but it's a word that is part of our society. So tell me, what is your definition of addiction?
Well, personally, I says it's a equal opportunity destroyer, but medically, it's actually a chronic pervasive brain disorder that impacts motivation, decision making, a lot of areas of one's life that becomes very problematic. So it's genetically based. So there's a lot of research that speaks to it being genetic as well, but it's definitely, it can prove to be very chronic and pervasive for some people.
Okay, and now when does someone know it's a problem?
Well, if the person that's suffering addiction starts to notice that things have become problematic in their lives, that's the first key. The other piece to that is when family and friends start to talk about how the addict is making missteps. There's a lot of denial, there's a lot of deceit. Things start to happen at work and at home and in relationships. In fact, all of the areas of his life or her life starts to suffer because of the addiction. And it's just a red flag that something's gone awry and needs to be addressed.
Okay, and there's some people who can go on in this, I guess, negative cycle of addiction for long periods of time. Long periods of time, and actually still try to wake up every day and try to have some sort of a normal life.
Yeah, but the key to recognizing the addiction is the fact that you're trying to control use. People without addiction, they don't have to say, I'm going to drink only at 5 o'clock at p.m. and only 5 ounces. It becomes problematic with the controlling and the hiding and the justifying how much, how often, where, with whom. Most people that are social drinkers don't worry about things like that.
That's very well said, Virginia. Well, we're here in New Orleans, Virginia. I have to, bring that up. And
yes,
I mean, it's hard.
It is.
All of us enjoy cocktails here. It's just we have this wonderful culture of food and drink, and a great parade called Mardi Gras, or a great, every year it always seems like there's a parade going on. So, let's talk about New Orleans and what you're seeing in your business today in terms of what are people seeking help for most?
Well, there's always the alcohol. But we find that pain pill usage is pretty pervasive. We find a lot of heroin, IV users. But even more than that, there's a plethora of drugs that are being used. There's Mojo, Spice, all the synthetic marijuanas that some of the younger people are using, and it's causing problems in their lives. They're going to the ER in so many numbers because of the effects of synthetic marijuana, synthetic LSD.
Okay.
There's so many names out there, but if parents and loved ones want to be aware that it's not just alcohol and it's not just cocaine anymore.
Okay.
That there's so many things out there that puts one at risk.
Okay, and I'm sure also there's a lot more options that are becoming actually less expensive.
Absolutely.
Are you seeing that? So kids have more access and
they're packaging it where it seems harmless and it's accessible and it makes it attractive. And a lot of times, labs don't necessarily test for it. So it's one of the things that a lot of young people will use to beat, urine drug screens.
Wow.
Yeah.
It's definitely for parents and also for siblings and family members. Again, it's all about knowing the signs and symptoms, okay? Because all of us know that guy or that woman who drinks too much at a party, and it's a pattern. You see, oh, there she goes again. If you can help or give some advice tonight for our viewers, are there any certain signs or symptoms that, or typical symptoms that an addict, would display or?
Well, I mean, anytime someone uses a substance, they're altered. You know, and if you're used to that person presenting one way, and then it becomes more apparent that their moods changed, their sleeping patterns have changed, their friendships have changed, you know, the way they speak. There are a lot of things to look for. I mean, if it just seems a little off, it's always areas of concern. You can ask the person.
Right.
You know, but one of the characteristics of the disease is that it's very secretive, and there's a lot of denial attached to it. So it's really hard for someone to really know if that person's just going through a phase and there are external things that's creating all of these changes. But if they become pervasive, if you start realizing that, you know, they're stealing and they're not fulfilling obligations the way they used to, sometimes that's a red flag.
Wow. Well, I'm glad you brought up the secrecy things, because through social media we received some questions, and one of them was basically someone wrote, you know, I have a coworker who smells like alcohol every day. Do I report it? Should I confront him? A lot of people are faced with this and they just don't know what to do, because you're afraid to confront someone because, you know, they'll be upset. What are your suggestions on dealing with that if you think someone has a problem?
If you think they have a problem, I personally would approach that person.
Okay.
If I find that if they're on the job, if I'm a coworker and this person is coming in and they're disrupting the office in some way or impacting our productivity and impacting the way our office runs, then I'm going to, you know, confront that person, or I'll take it to our manager and ask that they further investigate.
Okay.
You know, but just because someone smells like alcohol every day is not really indicative of addiction, but there has to be other behaviors that come with it. That would be a beginning. But if that person somehow it seems to be a little off and making a lot of mistakes and having different mood swings, something else may be going on.
Okay. All right. Well, now let's talk about the treatment program. And then, Cecilia, we're going to talk to you about your story, and your amazing story, actually. So here we are. Someone's watching the show tonight. And everyone, if you do know someone who needs help, these are the guys to call. So let's do it. Let's help some people. So when someone decides, first of all, it's a big moment. You know, we hear that term rock bottom. What does rock bottom really mean? Because I'm sure it means different things to different people.
It does. I mean, for me, I think it's just when that person realizes that things have gone too far out of control. You know, everybody's bottom is different. You know, some people can just lose a job and like, that's it, I'm done, my life is crazy. But then somebody may go to jail, get a divorce, lose their kids. So it's different. But if someone recognizes that their use of any substance, you know, whether it's or behaviors, you know, addiction manifests itself in behaviors. It could be sex or gambling or food, other than substances. But if it becomes problematic, if there's cravings and you know, intense compulsions and a lot of attention to that substance or behavior, they can call our office, go on our website, fill out an inquiry, and we will contact them. But if they call, they'll talk with our administrative secretary, who will schedule an assessment. They'll come in, the front line would probably be me. I'll do a clinical assessment, get their history, and then Dr. Malik and I will consult, and he'll meet with that person if they have agreed that IOP, intensive outpatient treatment, may be for them. So a thorough assessment and about where they are right now, what's become problematic, if they've incurred relationship problems, legal problems, health problems, and it's all around a substance, then yeah, they need to come in and at least inquire.
Sure, absolutely. And now a lot of people think that, you know, in order to get help, they have to go away someplace. You know, we see that on TV. Oh, you know, a lot of celebrities, they go to rehab, you know, and they come back feeling great, and then it doesn't seem to really, you know, some of them are successful, some of them are not, but they kind of glamorize that whole rehab thing. But the reality is people have financial issues, they can't leave their work, they have children, they have responsibilities while, you know, they're even, you know, they're addicts. So how do you help people who want to get help but have all of these other responsibilities going on?
And we don't want to interrupt the flow of one's life if they really want help. They can come in, and we have a 7-week program.
Okay, so it's 7 weeks.
7 weeks, 4 days a week. It's we have an evening program that's 5:30 to 8:30.
Okay.
So they can go home. They can come after work, or they can come in and go to work.
Okay.
Dr. Malik, if they're on medication, they're medically followed. There's random urine drug screens for accountability. But there's always the support there. I mean, we work with anyone. They come in and they're talking about how difficult it might be to meet those hours. We're willing to talk to them about setting up a schedule that works for them. And I mean, it doesn't change much from the 4 days. I mean, but we believe that intense work is important, you know, that you just can't come in and out and hit or miss if you really want to get your life in order.
Okay, so the program is 7 weeks
7
long.
weeks.
So what
4
happens?
days a week.
Okay, it's 4 days a week, 7 weeks. That's guys, that's a great investment in one's life, right? Okay, so what happens during these? You know, just give me a little bit of insight on what happens during these I guess meetings with you, the groups.
We provide a lot of education about addiction, you know, the brain disease. There's a lot of education about recovery, you know, resources available to you to get outside support, outside of the group, outside of your family. You know, we know that 12-step programs work, but we do offer resources that allow one to kind of pursue other options.
Okay.
But the groups are designed to address relationships, communication, managing emotions, you know, good self-care, sleep hygiene, all of that. And then, of course, on our team, we've got an acupuncturist, Dr. Lee, is coming on board with us that will educate the patients and their families about acupuncture.
Okay, so the acupuncture, I guess, is that utilized or recommended during the detox process?
That's ongoing. It's one of those things that
Okay.
Dr. Lee calls a green treatment. You know, when I guess typical medicine doesn't work for one person.
Sure.
He believes in acupuncture, so and he's well trained.
Okay. That's excellent. And also, I know, so, you know, your concept is a holistic. Holistic. And so through that holistic approach, you know, which I think that approach is awesome because it kind of softens the whole recovery process, I guess, so to speak, at least in my eyes, and other people that I've spoken to who have interest in this type of I guess comprehensive approach. So I know that you also teach people about nutrition.
We have a nutritionist that will come in and consult.
Okay.
Eventually, once you know the program
Sure.
is full going. We also have a guy that's probably a New Orleans native, that Jim Baird, that will come in and talk about yoga and meditation and breathing. You know, a lot of times addiction brings so much stress that we have to help the patient learn how to relax and deal with those warring emotions that come with, first of all, being really shamed and guilty and remorseful around behaviors that they engage in while in their active addiction.
Right.
So always meeting that person where they are, you know, mind, body, soul, and spirit is really important to their healing.
And there's and you know, addiction does not have a race, it doesn't have a religion, it doesn't have any type of demographic, right? It happens to all families.
All families.
All
and
families,
we have that.
right?
We have a family component, which is really important. You know, person going through treatment will need support, and family is usually the go-to unit.
Okay.
So we do have a Wellness Wednesday, along with the acupuncture, the yoga, meditation, and family education. You know, the family needs to know what this disease is about.
Absolutely.
And they sometimes find themselves addicted along with the addict.
Absolutely.
So getting healthy and into their own recovery is really important as well.
Right, and breaking that cycle,
Breaking the cycle.
because you know, if you've hid your husband's, let's say, drinking
Enabled.
problem, you've enabled, which I want to talk more about enable, you know, in just a minute. But now I'm excited to talk to you, Cecilia. First of all, thank you so much for being here tonight. So, Cecilia, tell me a little bit about, you know, your background and your story and your journey of you know, healing.
Well, I could just say I'm the typical mother, newly grandmother, middle class person next door that I guess the functioning alcoholic would be the term. And I think back to its beginning, I now understand that it was for relief from depression that I had carried around with me most of my life. And I think that part of my recovery success has been understanding that there was that outside component to why I drank. And it was something that I hid, just like you were saying. You hide it and you feel shameful about it because of the stigma that goes along with that, and with having a depression and being treated by medications. You want to keep that person that you would like everybody to know you as out there. So I did. I was very good at hiding it, very good at being up in the morning and taking the children to school, but just all day long was my thoughts of when I could get back home and get out my drinks and see how I could spread them out and not let anybody really notice that I was.
Okay.
And I think that the theory of rock bottom wasn't really something that I knew at all back then, but I would say that my rock bottom was really, it slowly was mounting in me that there was something I had to do. Was I really, I had to define it. Was I really an alcoholic? What makes me an alcoholic? So I would look it up. How many drinks is normal? And, you know,
Sure.
so I could really face myself.
You were
and say-
reasoning with yourself.
Because the denial is so strong, and it keeps you, it's like two people. You're two people.
Okay.
One is the devil and the angel. But finally, I started to talk with other people and notice that they had the same signs that I did. They were very secretive about it, but when they saw there was another person they could talk to about it, it sort of opened up. Yeah, I hide my bottles here, or I spend my money and I say it's this, and I wait till my kids go to bed. It was the same pattern, and I thought this is something I need to try to look into. So I went to a treatment center. I turned myself. I didn't tell anybody because I was ashamed.
Okay.
And it was outpatient, afternoons. Nobody knew. I could just come and go, and it was a short time. But it helped me a lot finally with being around a group, because I hid. I did it all by myself. I wasn't a party person. It was a loner thing.
Okay.
And I think that through some of them, I started to pick up on myself and my faults and how I was looking away. But there was only a certain point at which that helped me, because then you're on your own. You go back out there and, okay, if I stay sober, everything will be fine.
Right.
But the depression was still there, and that treatment wasn't there for that. I didn't know how to get back those fun things, because the want of being back, just numbing yourself out for a few hours was easy, and it was there.
Right.
So, but meeting Dr. Malik, he tries to bring out all those things you've buried that made your life better, that was better before that depression. So that was part of it. That holistic part was treating the depression. You treat the environment outside of you that keeps triggering those events and teaching you how to handle them. And through her counseling, she was very good about pointing out, how to be selfish. You've got to take your time, don't overload. And part of that was me being just not aware that I let things mount, and then I would cure it by getting some alcohol. But the tools they gave me were broad, and they supported any direction I wanted to take. Because I believed in things like yoga and meditation, in nutrition, all those factors. And there wasn't just like one way, just quit. You had to learn to incorporate those into your healing. So that alone gives you back your confidence and your power over being able to say no to the alcohol and yes to your life again.
This is wonderful, Cecilia. What a great story. And so, for how long have you been in recovery right now?
For this recovery has been 4 or 5 years. And it's my second one. My first one was when I just did it cold turkey, white knuckled it, and just said I can do this, and it failed because I didn't have the understanding of why, which I found through the help of the center, the way they address all of those.
Wow. And so because they addressed obviously your depression and all of those things you had buried your whole life, which, I guess pushed you to drink, which then developed, you developed an addiction. I guess, your insides feel really good after this, right?
Yeah, I think of it as a dependence more than addiction. I don't know if it's different for everyone. But I had a sense left in me that it wasn't really the alcohol and me. I was using it to help me get over something else. And to find that was what was the key, and to have the support of the counseling and Dr. Malik and his big horizons. He's very much helped.
Well, I think your story is unbelievable. First of all, you're so brave to be here tonight, and thank you for doing that. I know that it's a tough topic, guys. So we have to thank these ladies for being here tonight. But just some final words of advice, Virginia, because this show goes really quick, real quick. Great topic as well. Is that final words of advice for anyone who's watching the show tonight who either has a problem or knows someone who has a problem. They just feel afraid to call. Usually we get calls on the show. I know some of you wanted to call, but you feel that they feel like they're confident. There's a lack of confidentiality, or somebody's going to find out. Just like you said, Cecilia, that is, I think, the biggest worry, right? Is what if people find out? What's going to happen to me?
Right.
So how do you deal with that? What words of advice can you tell people to just pick up that phone and get help?
Well, if it's the addict themselves, I mean, it takes a lot of courage.
Right.
Talk to somebody, that you trust, and ask them to help you make the call if you need that push. If it's a family member that has a loved one, call.
Okay.
Even if it proves that they're not an addict, that they're just going through some abuse, it's better to know that than not. But just pick up the phone. I mean, you can call. Our inquiry is easy. You can come in and talk to myself, Dr. Malik, any of our staff, and just kind of feel your way through it. Get the assessment.
Absolutely.
But it takes a lot of courage. It really does. A lot of courage and strength. You have to move so far from that denial to just say, nobody wants to do a happy dance around being an addict. And so it's really difficult. And sometimes just inquiring, even if you just take the online assessment.
Right. They have a great online assessment tool, so when you can check that out on their website. Well, I think, tonight was definitely a big eye-opener for me as well. To hear your story has truly inspired me, and it's inspired me to share, the good, just the resources that you offer, and how, guys, we're just, we're not alone, right?
Absolutely.
You're not alone. So if you need help, there's people there to help you. You don't have to do it alone. And, you were put on this earth to do this great job, and you do it well.
It's my gift.
It's totally your gift. Thanks for being here.
Thanks for
Thank
having
you
me.
so much, Cecilia. Thank you so much for being here. All right, so for those who want to contact Gulf South Addiction and Wellness, you can call 504-529-9500, or you can visit their website, gulfsouthaddictions.com. I'm Maria Muro, and I want to thank you for tuning in to Doctors New Orleans. Remember, if it's about health, we cover it, and we want to hear from you. Thanks so much for watching tonight. We hope you've found this show informative, educational, and inspirational. Stay healthy, and good night.
Doctors New Orleans is underwritten by Acadian Ambulance Service and New Orleans Living Magazine.
What if there was a hospital that treated childhood diseases while still allowing kids to have a childhood? It would require thinking on a smaller scale in order to lead to bigger possibilities. It would require doctors and nurses with imaginations as big as those they treat. It would require putting children's lives before all else. It would require a hospital whose singular focus is children. That's Children's Hospital New Orleans, caring for every child as our own.